Welcome back. I am Professor Archana Rajasundaram from the Department of Anatomy, Sree Balaji Medical College and Hospital. Today's topic is axilla and axillary lymph nodes. The axilla is an anatomical space located between the upper thoracic wall and arm. It is necessary to have a thorough understanding of this region because of the structures present here. The nodes, the axillary lymph nodes, are of clinical significance as their involvement is of important prognostic variable for breast cancer patient. The axillary walls are used as a landmark by surgeons to prevent damage to the neurovascular structures present here. The objectives of today's topic is define the boundaries of axilla, enumerate the contents of axilla, classify the axillary group of lymph nodes, and describe the areas of drainage and applied anatomy. The axilla. Axilla is a pyramid-shaped space between the upper part of the arm and the side of the chest. It is a gateway for nerves, blood vessels, and lymph vessels. The axilla is a four-sided pyramid having an apex, base, and four walls: the anterior, posterior, medial, and lateral. The apex of the axilla is directed towards the root of the neck. This is known as the cervico-axillary canal. It is bounded in front by the clavicle, behind by the superior border of scapula, and medially by the outer border of first rib. I repeat, it is bounded in front by the clavicle, behind by the superior border of scapula, and medially by the outer border of first rib. It forms an important passage for nerves and vessels as they travel from the root of the neck to the upper limb. The structures which travel through the root of the neck are axillary vessels, cords of brachial plexus, long thoracic nerve, and subclavian lymph trunk. The base of the axilla, it is directed downwards and is formed by skin, axillary fascia. This is supported by a ligament called a suspensory ligament of axilla from above by a fascia which is called as the clavipectoral fascia. The base is bounded in front by an anterior axillary fold, posterior axillary fold, and medially by the chest fold. This anterior axillary fold is formed by pectoralis major muscle. Behind, the posterior axillary fold is formed by tendons of latissimus dorsi and teres major muscle. The base is formed by the chest wall. Now coming to the walls of the axilla, we have four walls: the anterior wall, posterior wall, medial wall, and the lateral wall. We'll see one by one what structures form these walls. The anterior wall of axilla is formed by the muscles pectoralis major, pectoralis minor, subclavius muscle, and a fascia called as the clavipectoral fascia. I repeat, the anterior wall of axilla is formed by pectoralis major, pectoralis minor, subclavius muscle, and the clavipectoral fascia. The posterior wall of axilla is formed from above downwards by muscles subscapularis, latissimus dorsi, teres major. I repeat, subscapularis, latissimus dorsi and teres major muscles form the posterior wall of axilla. Now coming to the medial wall of axilla, this is formed by the ribs, the upper 4 or 5 ribs and the muscles between them. These muscles are called as intercostal muscles. Apart from this, the origin of upper part of serratus anterior muscle which is present in the medial wall along with the long thoracic nerve. And there's another nerve called as the intercostobrachial nerve. This is the undivided lateral cutaneous branch of second intercostal nerve. It pierces the medial wall to supply the posteromedial part of the arm. So the medial wall of axilla is formed by the upper 4 or 5 ribs, intercostal muscles, serratus anterior muscle with the long thoracic nerve and the intercostobrachial nerve. Now coming to the lateral wall of axilla, it is actually the convergence of anterior and the posterior wall. So these two muscles, the anterior and the posterior wall muscles converge at a sulcus which is called as the intertubercular sulcus of shaft of humerus. So it is in that intertubercular sulcus we can see the long tendon of biceps brachii. And then you have the muscle coracobrachialis and short head of biceps which form the lateral wall of axilla. So the lateral wall of axilla is formed by anterior and posterior wall convergence, intertubercular sulcus of shaft of humerus with long tendon of biceps brachii, coracobrachialis and short head of biceps brachii. Now coming to the contents, there are axillary artery and their branches, axillary vein and their tributaries, lymph vessels and lymph nodes, the important nerve plexus, the cords of brachial plexus, the long thoracic nerve and the intercostobrachial nerve. The contents are, I repeat, axillary artery, branches, axillary vein and tributaries, lymph vessels and lymph nodes, important nerve plexus, the cords of brachial plexus, long thoracic nerve and intercostobrachial nerve. And also the axillary pad of fat and areolar tissue is also present here. Coming to the axillary lymph node, the knowledge of anatomy and the location of axillary lymph nodes are of clinical significance as they are often the first site of breast cancer metastasis. These lymph nodes of axilla, they grouped into, they drain the lateral quadrants of the breast, the superficial lymph vessels from the thoracoabdominal walls above umbilicus and the lymph vessels from the upper limb. These lymph nodes, I repeat, they drain the lateral quadrants of the breast, the superficial lymph vessels from the thoracoabdominal walls above the umbilical and the lymph vessels from the upper limb. These axillary lymph nodes are grouped into 5. The anterior or the pectoral group, posterior or subscapular group, lateral group, central group and the apical group. I repeat, anterior group, posterior, lateral, central and the apical group. We'll see one by one each group. The anterior axillary lymph nodes, they are related to the lateral thoracic artery. These are also called as a pectoral group of nodes. They receive lymph from the lateral quadrant of the breast, from the anterior lateral abdominal wall above the umbilicus. The posterior axillary lymph nodes, they are also called as subscapular lymph nodes. They lie in front of subscapularis muscles along the course of subscapular artery. They receive superficial lymph vessels from the back down as far as the iliac crest. The lateral axillary group of lymph nodes, they lie along the medial side of the axillary vein. They receive majority of lymph drained from the upper limb except superficial vessels draining the lateral side of arm. The central axillary lymph nodes, they lie in the center of the axilla in adipose tissue. They receive lymph from the anterior, posterior, and axillary lymph node groups. These finally they drain into the apical axillary lymph nodes. These apical axillary lymph nodes are located in the apex of the axilla at the lateral border of first rib. They receive lymph from efferent vessels of the central axillary lymph nodes and from all axillary lymph node groups. The apical nodes drain into the subclavian lymph trunk. Finally, they drain into the subclavian lymph trunk. Coming to the applied anatomy, first we will know the terms lymphadenopathy. This means enlargement of the lymph nodes. Lymphangitis means inflammation of lymphatic vessels. Lymphoma means cancer of the lymph nodes or the lymphatic system. The lymphadenopathy, the common causes include a local infection of the arm, including skin, wound infection, and cellulitis, infection of the pectoral region and breast, cancers including lymphomas, leukemias, and breast cancer. A lump in the armpit need not be a lymphadenopathy. It could be a cyst or abscess, a harmful fatty lipoma, or can be caused by some medications or vaccinations. Palpations of the apical lymph nodes. The apical group of nodes is the terminal barrier of the infection of upper limb or the mammary gland. So the enlargement of these nodes are palpated by pushing the fingers of one hand upward from the base of the axilla towards its apex, while the other is approached from above behind the clavicle. Block dissection. To remove these axillary lymph nodes, the surgeons perform the block dissection. So during that time, the axillary lymph nodes have to be removed en masse. So the axillary lymph nodes are contained in a fascial tent which covers the walls of the axilla. So you have the anterior wall, posterior wall, medial, and the lateral wall. So the block dissection of axillary lymph nodes when required is done by keeping the fascial tent intact. This fascial tent covers the four walls of the axilla. To summarize, axilla has an apex, base, anterior, posterior, medial and lateral walls. It contains axillary vessels, axillary group of lymph nodes, cords of brachial plexus and axillary pad of fat. The axillary lymph nodes are anterior, posterior, lateral, central and apical groups. The axillary lymph nodes are of clinical significance as they are often the first site of breast cancer metastasis. Thank you.